that's Matt, and yes, we are Susie Health Solutions and running Suzilla. We are here, we do health insurance if you haven't met us before. We're licensed brokers, and we're talking about the special enrollment period that has been opened up by the government to give us an enrollment period because of COVID from February 15th to May 31st. So they're giving us another 2.5 months.
Yes.
And of course, the rule of 15 applies.
Well, let's just let me send us all out and get us going here.
He's tweeting and stuff.
I'm tweeting and stuff and getting it going, and I've even got a little, what stay on track.
Okay, I thought it was on track.
Am
I off track?
You're a little bit off track.
Well, that's what happens when you just drag me higgledy-piggledy.
Okay.
So.
Here's Susie Health Solutions.
Yes.
And we are one of 11 enrollment centers spread throughout Washington State.
Correct.
We help people enroll and understand healthcare at zero cost to them.
Yes. And we're proud to do it.
We've done it since day one. Mm-hmm. So this was our 8th enrollment season.
Yep.
So we've been just rocking it out regularly. Mm-hmm. This is kind of a specialized program. We will see this July if we make it around the next year for outreach.
Okay.
And because we do a bunch of different outreach throughout the year to help people enroll in healthcare. Mm-hmm. Because if someone has Apple Health, mm-hmm. they have a documented reason. If they have Apple Health, or if they don't have any income, we can enroll them.
Right.
If they're affiliated with a Native American tribe, mm-hmm. we can enroll them year round.
Year round.
And there's a couple reasons that someone can enroll outside those two with documents. What are they?
Well, you're looking at if you've got a change of citizenship.
Mm-hmm.
You've recently gained citizenship. You got, you stood up and you swore your oath of loyalty to the United States, and now you're a citizen. That would qualify you.
How about if you got your residency card?
Yeah.
Mm-hmm.
If you have become a legal resident.
Okay.
The key is you have to be a legal resident. Unfortunately, that means our DACA, deferred action for something. What does CA stand for in DACA?
That was removed back in 2017. We're yet to see motion on it.
Yeah.
Yet.
We're hoping. Yes, but you didn't actually answer my question.
Yeah.
But what happened is our DACA, although the DACA recipients, although not necessarily although they've been paying bills and paying taxes and living a perfectly normal lifestyle, they don't qualify because they're officially not legal residents.
They're in a gray area.
They're a very gray area, and we're hoping that gets cleared up with this next political rigmarole.
Well, correct, but that's probably going to take legislation.
Oh, it's definitely going to take legislation, Matt.
No, I'm not going to say definitely take legislation because you could impact their health care without legislation.
Yeah.
At any given time, a state legislation could apply for the grant that allows people that are undocumented be able to purchase health care on a health exchange.
That's a whole nother podcast.
That is a whole nother podcast, but that is a possibility out there. You don't need to go through Congress. It doesn't take an act of Congress. There are other steps
other
to do
avenues. But either way, so change in citizenship.
Yeah.
If you have moved from another county or another state, if you are moving within the same state, you need to have options that you didn't have available to you in your current county. I think you have to. That's a gray area.
When you move, you're allowed to, it opens up a special enrollment if your plan's not in that county.
Right, but you have to have had insurance for at least 60 days prior.
Correct.
Right, you can't.
And that's the same if you get married.
Right, or move from another state.
Yes.
You can't just not have insurance and then get insurance because you got married, or get insurance because you.
It's the documented reasons.
Documented reason, and those are special reasons why you might be able to have health insurance. Having a baby or adopting a child is another special reason.
And what's the time frame allowed that?
Usually 60 days with stuff like that.
Yep. It's hard. It's the hard 60.
Yeah.
Because we've seen so many people. Oh, I did last November. Well, I'm
that's
sorry.
nice.
It doesn't help
You
you.
called me in November. You were in the annual enrollment period.
Correct. When is the annual enrollment period?
I know these questions. The annual enrollment period is November 1st to December 15th traditionally.
Okay.
And now sometimes we get extensions for one reason or another. Washington State extends its period frequently. It has probably 5 out of the last 8 years. Other states do. California's been known to extend it. This year we got an extension because of COVID, and now we're looking at a federal extension because of COVID.
And what is our extension this year?
The federal extension, which opens up healthcare.gov, if you were in, say, a non-exchange supported state, then you are looking at using healthcare.gov.
Yeah.
Yeah. And it's February 15 to May 31st.
Now, Washington State's also doing it.
Yes. We didn't have to, but we joined in because, well, we wanted to.
It's kind of that unity thing.
It is.
And it's not only the people that don't have health care, it's also people who have COBRA coverage.
Yes.
Or might be on a health share and want to graduate up to real insurance. Because there's lo and behold, some advantage to insurances. You mentioned something about the rule of 15.
Yes.
What is the rule of 15?
The rule of 15 is they use the 15th of the month as a deadline. If you enroll before the 15th of the month, then your coverage begins the first of the following month. So, for example, if you enroll on March 8th, your coverage will begin April 1st. If you enroll after the 15th, it begins the second month following. So if you were to enroll on March 16, your coverage would begin May 1st. That's the rule of 15.
Okay. So I know that they kind of haven't really told us what we're looking at.
Not entirely, no. They're still working out some details, it sounds like.
Yeah, we ran all of last year with the pretty much the flow of someone comes to us, we do the application, and then we put in for a approval. And that takes 24 to 48 hours, depending on that. And then we go shopping, and a person has up to 60 days to select.
Right.
They don't have to have cash in pocket.
Nope.
In fact, that's preferred. Usually what happens is the batch uploads happen on Friday, and usually by the following Tuesday, they're uploaded, and they can make a phone call in and make that first binding payment.
Yeah, it usually works out pretty good. It doesn't always work all the time, but it does work pretty well. And the Washington Healthplanfinder's help desk has been quite on top of approving those special those special requests.
Yeah, we rocked those out last year.
They didn't hesitate.
Yeah, I mean, we technically had special enrollment all the way from March 30th through November 30th.
Yeah, there was some flexibility for everybody in there for one reason or another.
Yeah, I won't say everybody.
Well, a lot of people. The last round was because of fires in Wenatchee County.
And that's the special events, because the Washington Healthplanfinder is its own exchange, and we own that. They own the process. So if with agreement with like the insurance commissioner or the governor, they could say, hey, it's an emergency. Let's open up this special enrollment and allow more people in. That's why we always say check in with a local enrollment center.
Exactly, because we know these details.
Yeah.
And we know if you might qualify for one of these special reasons.
And it costs nothing for people to show up.
Absolutely not. No cost at all to you at all. Period.
Yeah.
That was lumpy, but
yeah, most of us we set up. We're located in Wenatchee, but if someone sets up an appointment with us, we can phone it, or we can go over computer and do some screen sharing.
Yeah,
or
web chats are so nice.
Or we can even do in person if they choose to come in the office if they mask up.
Yep, because we have enough space in our room. We can actually do a 6-foot distancing, and we have big computer screens.
We have big computer screens. We got lots of sunlight that come in through the office. We got little robot cleaners. We got air fresheners. We got masks.
We have shields.
We have shields. We do just about everything to keep everyone safe because we've been running this way since like last April.
Mm-hmm. Well, yeah, that's when we started getting all the
protective gear.
Protective gear. Yeah, we don't hesitate.
Yeah,
and we have to insist that people mask up when they're in here.
Yeah,
that's okay.
Yeah, we got hand sanitizer.
Boy, do we have hand sanitizer. Matt loves. This is Matt's
the
favorite.
Greatest hand sanitizer
he
of the
says
planet.
It is the greatest hand sanitizer ever. It's got sparkles in it. It came courtesy of the Healthplanfinder. Kind of has a fruit punchy smell. It's quite lovely. It evaporates nice on your hands. And it kills bugs dead.
Yeah, we have a tendency to give that stuff out on a regular basis.
We raid the insurance companies all the time for stuff to give away.
Well, this came from the Healthplanfinder.
Yes.
And part of their Cascade Care. Yes, we got the new plans in, and we help explain them. And you can look at those. You can look at traditional plans. Since we are a broker, what we did is we built out to fill in the gaps.
Right.
Because there are folks over 65 that need health care.
Yes. And I help with that.
We help with that.
That's Medicare. Now, there are people under 65 who qualify for Medicare as well.
And we help them as well. We've also, the undocumented, we also have plans off the exchange that we could do during an open enrollment.
Correct.
I don't know if they're really that kind.
Off with these special enrollments?
With the special enrollments.
That I don't know. We've never really tried that. We never really figured that. We never had a need to dig in that one. So let's see how
that's a delicate situation.
It is a very
delicate. You don't get tax credits, but you do get health care.
Which is important.
So we've got that. We've also, for the folks that travel, we did one this year.
Yep. People hoping they were going to be traveling.
Well, no.
They were camping.
They were camping.
We'll see a lot of camping this year.
So what we do is we found a travel exchange.
Yes. And we can set you up with a travel policy.
So if you've got like a tight network that you're going outside of, that's an easy way, a cheap way to do it.
Okay, so for example, if you've got health insurance in Washington State, you want to go to Moab and hit Utah and camp down in the Utah
the pillars
and those cool
mesas.
The national parks down here, which is exceedingly cool looking. If you have an injury, you can be covered with emergency room care. But if you have a travel policy, you can have even better coverage that they can bill first.
Oh yeah, there's some crazy stuff there. We also take care of life insurance.
Yes, we do life insurance as well.
We also have an exchange for that.
Yes,
we make things as easy as possible for people to understand insurance. We've had dental and we've had individual vision.
Yes, for years.
Those were actually the first two things we put on.
Yes, I think dental was first.
Dental and vision came on about the same time.
Yeah.
We did both simultaneous. Then it was Medicare because we initially started referring out, and as the need grew, and Susie said, "I want it," so
I took it.
She started doing it.
I love Medicare.
Then we added life because people kept asking us about life questions. Then about the same time we added the accident plans to cover those high deductibles.
Yeah, a lot of the plans available these days have a high deductible for the non-basic care.
We will talk about that on another show.
Okay, but the accident plans can help cover that
because that is really.
That's a whole other show.
That's a whole other show because what Susie missed there is coverage that happens before a high deductible.
Well, you didn't let me get there.
Of course not. I'm trying to. I want nice, easy softballs for this one, and we can go into more details.
We will totally go into more detail. If you want more detail, call. I'll talk to you about it.
Yes. So yeah,
the accident plans are great for covering. For accidents.
Yeah. So yeah, that is it. We're gonna keep it a short one today. This is the special enrollment.
Yes.
So if you know someone that needs health insurance in Washington State,
yes,
you can send them our way. You can
Yes.
say, hey, talk to these guys.
Yep, talk to Susie and Matt. I'm Susie, that's Matt.
Yeah, that's really simple. We don't charge a fee. We help people. If someone's got a current plan on the exchange and needs some help understanding it, send them our way. We can take a look at it and tell them what they've got.
Now, one thing we do need to, there is a caveat with this special enrollment. If you have a plan, you can't change it.
Yes, you cannot change your plan.
Yep.
They made that explicit.
Extremely clear, big bold letters in the email.
Because I've done a few of those earlier, with other years.
Yeah, they're not letting us do that this time. You have to be changing from a COBRA or a healthshare or not insured at all.
Yeah, those are the three. COBRA, MediShare, not insured.
Yep.
Don't play the change game.
No.
Change game comes November 1st.
Right, November 1st is when we can make changes. Higgledy-piggledy.
Or if your income changes more than $150 2 months in a row.
Yep, and all the good stuff.
Because income does change.
Yes, it does.
So we're going to get going?
Yes, we are. We got things to do, people to see, places to go, things and stuff.
Stuff and
Thanks
such.
for joining us on Suzilla.
Yep.
We'll talk to you another day.